Hi, my name is Cameron Keller. I'm a student nurse here at the College of Nursing, and today I'll be performing an indwelling catheter insertion. Here's my ID, and my video is going to scan the room. The first thing I want to do is verify my order and my hospital policy, and then I will perform hand hygiene, and then I want to make sure this is my correct patient. So I'm going to use my order form and my wristband to make sure this is Miss Jaguar Jones. Miss Jaguar Jones, her date of birth is 8/25/1963, and then her date of birth on here says 8/25/1963. So this is the right patient. Now I want to assess her allergies. So I see she's allergic to penicillin on the order form, and she has a wristband that says she's allergic to penicillin. I also want to ask Miss Jones if she's allergic to anything else or something we should be aware of, and she is not. So now I want to explain the procedure to my patient. I want to tell her that I'll be inserting a catheter in her and that it shouldn't take long and it won't hurt. So now I'm going to state 3 indicators that are conditions justifying the indwelling catheter, and 3 of those conditions would be to assist in healing of open sacral and perineal wounds in incontinent patients, acute ventilator-dependent respiratory failure, and acute worsening of mental status. So now that she does need a catheter, I'm going to provide privacy for my patient, so I close the curtains, and then I want to gather all my equipment, which I have here. I'm going to don my goggles, move my trash can to a working position, and perform hand hygiene. And then I'm going to raise the bed up to a working position, lower the side rail, and I want Miss Jones to be in a dorsal recumbent position with her legs slightly bent, and I want to make sure she's comfortable. So after I make sure she's comfortable, I'm going to apply some gloves, and I'm going to perform perineal care. So with perineal care, I want to do this with soap and water, and this will ensure that there's no contamination when inserting the catheter. So for a female, I would use a washcloth and start on the left labia and clean front to back, and then I get a new washcloth and do the right labia front to back, and then go down the middle with another washcloth to go front to back. So for a male, I would hold the shaft of the penis, and starting at the tip with inner to outer, I go in circular motions and using a different washcloth with each thing. So after I perform perineal care, I'm going to open my kit. So I'm going to lay my kit like this, and then I'm going to use this as a trash bag. I'm going to put it at my patient's hip. Good. Okay, and then I'm going to open my sterile field. I want to open it away from me, and minding the 1-inch border. Okay, so now I'm going to remove my gloves, perform hand hygiene, and don my sterile gloves. So now I have my sterile gloves on. I'm going to pull out my drape, and this is all sterile. I want to put the shiny side down, and I'm going to fold it like this so I don't touch my patient's legs. And then I'm going to take the tray off, and I would usually unpackage my betadine kind swabs, but I already have them undone. And then I would take the lube and put some right here and throw that away. And then I'm going to get my syringe, uncap it, throw the cap away, and then I'm going to take this out for later and put my syringe on my port. I can unpackage the rest of this and place this in the trash. And then I'm gonna put this in the loop. And for a female, I want it to be 1 to 2 inches, and for a male, I want it to be 5 to 7 inches. So I'm gonna place it in here. And then I'm gonna put my box out a bit closer. Okay, so now I'm gonna perform perineal care for the female. So I'm gonna open here, take a cotton swab, starting at the left labia, go front to back, here, down, start to the right labia, front to back, down, and in the middle, front to back, down. And then for a male, I would hold the shaft of the penis and clean from the tip to the glandus penis in a circular motion. And I want to make sure I keep this open so I don't break sterility. So now I'm going to insert. I need to tell my patient to bear down or take a deep breath and exhale while I'm inserting. So I'm going to move this a little bit closer. Okay. So I'm going to insert until urine is returned, and then I'm going to insert 1 to 2 inches more on the female, and then for a male, I would insert until bifurcation. So now I'm going to inflate the balloon. And come up here and hold pressure. Take it off. I would usually disregard this, but I'm going to keep it because I'm going to need it later for today. So I'm going to put that down. And then I would pull it back and then slightly and then push it back in. Okay, so now I need to insert a stat lock. So I have my stat lock here, and I'm going to take it out the packaging, and then put packaging in the trash. And then I'm going to clean the upper thigh with the alcohol pad, like this, and then I'll disregard that. And then I want to place the stat lock on the upper inner thigh, and I want to make sure that I leave a little bit of slack so there's no tension on the urethra. So this is how I'm going to show you how I would put the stat lock in. So I need to open it. Then I would place it like this and close, and then close it, and then I'm just going to take it off for now. Okay, so now that's how you place a stat lock. So I'm just going to put that there. Okay, so now after my stat lock's in place, I can hang my bag. So I'm going to take my bag and hang it on the bed frame, not the bed rail. I'm going to hang it on my chair just for right now. So I'm going to undo, hang it on I want to make sure it's below the bladder and that the loops are like straight. And there is also like a little clip that I could clip it on the bed with. Okay, so now I'm going to collect the specimen. So if you want to collect the specimen and after you just insert the catheter, you're going to use the bag. So I'm going to open this container and put the cap down here. I would have a towel and a container under the bag just in case there's any like drippings or anything. So I'm going to come down here, undo bags, and then I would just put some in, making sure not to touch the outer rim of the cap, and then put it back in, and then I would close it, label it, and send it to the lab. And then if I want to get a specimen collection a couple of days after inserting the catheter, I would do that at the port. So first I would need to kink my tubing like this, and then I would get a syringe and make sure that it works properly. Some water, and then I put it in this port right here, and just take as much as you need out, and then I would put it in the container with the cap off, obviously, and put it in the container and just not touch any of the sides. I'm gonna keep this for later because I'm gonna need it. So then I would label it and send it to the lab. So after I've collected the specimen I need, I can clean up my space. But I also want to make sure to unkink this because that could really harm my patient. So I'm gonna unkink it. Okay, so now I can clean up my stuff. So I'm gonna clean everything up. I could remove my gloves and perform hand hygiene. I also want to put the side rail back up and the bed back to a low position and make sure the call light is in reach and that anything that the patient needs is in reach. So now I want to document. I'm going to document the catheter size, the amount of urine, the color of the urine, the consistency of the urine, how the patient tolerated the procedure, and the specimen collection. I also want to note that I would come and clean the catheter daily and after there's an incontinence of stool, and that I would remove the catheter after medically indicated. So now I'm going to show you how to remove the catheter. So I would perform hand hygiene, put on my gloves and my goggles, which I already have on. And then I want to drain the urine bag, with a towel and a container, and I want to measure it, to make sure to measure it. So to take the catheter out, I'm going to use a 10 milliliter syringe, and I want to make sure it works properly. And I'm going to insert it in the port. I'm going to pull it back a little bit first, and then insert it in the port. And I'm going to let gravity do all the work. I want to make sure it's all removed before I remove the catheter because that could really cause harm to the patient. Okay, so usually I would let it all come out before taking the catheter out, but it's not coming out in a timely manner. So for time's sake, I'm just gonna move on. So usually I would take it out after it's all, make sure all the water's out. And I would throw everything away in my trash can. Then I want to perform perineal care again, just like I did earlier to my patient. And then I can remove my gloves, perform hand hygiene, and then I want to document. I want to document the amount, the color and odor, and the consistency of the urine, how the patient tolerated the procedure, the intactness of the catheter tip, how much of the balloon drained, and then symptoms of a UTI, which would include things like fever, nausea, and vomiting. And I also want to note that I would come back and assess my patient after 4 to 6 hours to see if they're voiding or not. And if they're not voiding, I want to either palpate the bladder or get a bladder scan. Thank you, that's it.